Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
What is up, Tucson? This is another episode, and I'm excited for today, of the Vitality Vault with myself, Dr. G, and the lovely Dr. B. Dr. B, how you doing?
I am doing just well today. Thank you.
Nice. So today is a
you?
special... Oh, before we get started, I am doing great. Thank you for asking.
Yeah.
That really warms my heart that she asked that.
Yeah. Today we're doing a really important topic.
Yes. But before we get to the topic, I got to show off my swag, right? I got to show off my stuff. So the socks I'm wearing today, this was a gift from my sons, and it literally says Fart Ninja. I don't know where they got that from because I'm not the geisha's type.
This is the house I live in.
No, I'm not the geisha's type. No, that's not me. But yes, so this is my special sock for today, Fart Ninja. Thank you, sons. Daddy still loves you. So we are going to dive into the topic of hormones, and I think it's a big one.
We're doing women's hormones.
We're
today.
starting off women's hormones, yes, because
Yes.
it is huge. And a couple stats before we dive in, I want to hit you with. I was reading, and it turns out that every day in the U.S., 6,000 women go into menopause.
Wow.
Every day. That's a lot of women dealing with the stress and the tribulation of going through that change of life, so to speak.
Yeah, no, absolutely. It's a huge one, and it's ever changing in terms of symptoms and the age that it happens and how it affects not just the person but others around them, their whole lives basically. So there's so much that we could discuss in women's hormones. So we're going to be doing this part series first, but we're going to be talking more about this topic later on. We'll come back. Of course, we will bring in maybe in the next series men's hormones or men's health.
Yes.
But women's hormones is so much more complicated.
Much more
It's
complex,
crazy. Yeah.
I mean, even the patients that we treat and the ones that we have guided through this journey of change to almost getting to the other side and doing much better. Seeing a lot less of the woes of going through menopause, which I think is important because I'm a physician, so I understand the science behind what happens with the hormones in a woman's body as she goes through that process. But most lay people or lay husbands or boyfriends, they don't get it.
Right.
So those fluctuations can cause some serious problems in relationships.
Right.
Especially when the other person doesn't get why or the woman is going through or having these changes or not being herself, so to speak. It's tough.
And it looks so different with everyone.
Yes.
So I've been doing hormone replacement, specifically bioidentical hormone replacement for a while now. And it looks so different for every woman. The symptoms it presents so, like, it could be brain symptoms, GI symptoms. We'll talk all about that stuff. But just personalizing their hormone replacement as well. Like, there's such a vast difference from one person to another. So even if you understand the science, like just us seeing this in our practice and seeing the different clinical presentations has opened up our eyes so much. So, when you're looking for someone to help with hormones, you want someone who's experienced as well too, just to understand like the different individual changes you could see and what's needed to help each person through.
And the word you said, which I love, Dr. B, was personalized. That's important because I think in Western, in our medicine that we practice, evidence-based, we tend to do things cookie cutter. Like we treat blood pressure with specific doses of medications based on what the studies have shown, right? So you'll do a 5 milligrams, then a 10 milligrams, then a 15, then a 20. So it's kind of it's almost like block the way it's done. With hormones, you really shouldn't do it that way because one person may need this amount of micrograms, and another one might need this amount, and the other one might need this amount, and each person's different. So we do advocate for people having a more personalized approach to this because what happens in Mary's body is different from Joan, is different from Susan, is different. And that's how it goes across the board. So Dr. B's right. Having someone who understands true hormone metabolism and feedback, it's a big topic, and let's break it down.
And like you said, there is a cookie cutter approach too, because it is available via the regular farm. And we'll talk all about this via the regular pharmacies. You say the commercially available ones, where they're fixed doses. But I do a lot of compounded hormonal medications where you can microdose, where you can change things up as needed. So we'll talk all about that. But we're kind of getting ahead of ourselves.
We're excited. We are excited to bring this topic because
so let's talk about the good, the bad, and the ugly. We're talking about women's hormones. So first, we want to talk about the key hormones when we're talking about female hormones and functions. So you could see up here a list of the first one, which is estrogen. We have the actual chemical compound on the left. And primary function, so when you're talking about a younger female, developmental of the female secondary sex characteristics, so, development of the breast, and other, the way the female looks, basically. Estrogen has a large part in this. Regulation of the menstrual cycle, for sure. It helps, usually when you're young, you never find anyone that's young and have like osteoporosis. No. So all these hormones help to maintain bone health, definitely helps to protect against heart disease, and many studies have shown this. Helps with mood, helps with cognition. It actually helps with insulin sensitivity as well. Helps to maintain skin hydration, and it does this via collagen formation, so it's important for that. Definitely helps to prevent vaginal atrophy, and also helps the urinary tract, helps prevent UTI and urinary incontinence. So estrogen is important for a woman.
Pretty important. And I mean, if you look at some of those that we had that you just mentioned, Dr. B, there's a lot of deep science. Like with regards to the cardiovascular, it's important to have a healthy estrogen balance, not over and not under, but a healthy middle of the road balance of the estrogen hormone, because it does help with cardioprotection by reducing inflammation and by reducing the stickiness of plaque within the arteries, and also by helping the arteries be more flexible as we age, to be honest. So it's pretty important. Estrogen is pretty important.
And honestly, there are more functions. Like tons. We could get really deep. Of course, I wanted to keep them kind of just, to the point, concise today, and we'll go deeper later on with this. So the next one up is progesterone, a big one again. Primary functions here, preparation of the uterus for egg implantation when we're talking about pregnancy. This is very important to provide a good environment and to maintain pregnancy. It helps with fetal brain development in that fetus. It helps, of course, with estrogen to regulate the menstrual cycle. Also with estrogen is there to help promote collagen formation and skin hydration. Protects against heart disease. We just talked about hormones and heart disease, very important. Dr. G just talked about the lowering cholesterol and voiding plaque lay down. And it helps to improve brain function, promotes normal sleep, healthy bone density, and definitely progesterone is really important in breast and endometrial tissue protection. And you were just talking about the balance. And one very important thing is remembering to balance that estrogen and progesterone. Usually when we're younger, early menarche, etc., the balance is there for, I would say, up to maybe in your early 30s. And then we can see some imbalance happening where sometimes you can have dominance of estrogen, but that does put you a little bit more at risk for breast and endometrial. Endometrium is that lining in the uterus. It does put you at risk for increased risk for cancer, other conditions later on. So that balance, again, as you saying, pretty important. And everybody sometimes forgets that women also need testosterone.
That is true. So I know some physicians who definitely avoid discussing testosterone, or they think that women don't need testosterone, which is
no, it is important.
Wrong.
Yeah,
it is very, very important. I mean, with me in the regen world, and Dr. B is deep in the hormone world, me in the regen world, we know for a fact that a lack of testosterone or decrease in testosterone drive can lead to more muscle aches, more joint aches, and worst case scenario, it can lead to ligament and tendon damage. So, for those patients who are, let's just say, not on any kind of testosterone replacement, and they do have subtherapeutic or low levels of testosterone, and you're in your, let's say, 60s, you want to pick up a sport. So what do you pick up? Let's just throw one out there. Pickleball, right? That's a big one now, right? There's a lot of strain on the knees in pickleball. So if you're someone who is postmenopausal and now you want to pick up a sport and you pick up something that's very taxing on the joints, just be careful. My advice is, if you know you're in that age group, talk to your doctor, and see if it's something. And also, if you have other symptoms as well of testosterone deficiency, talk to your doctor and see if maybe this would be good for you. Because the last thing you want is to damage soft tissues in the joints that kind of take away your quality of life. Because now you can't exercise, you can't play your sports.
If you look at a young, healthy woman and you measure all her hormones, you find a good level of testosterone in her body. So, I mean, we do need it for certain functions. You could see a list of functions up here. Definitely for libido, it plays a big part in that. Bone health, like the other two that we spoke about. And Dr. G said the muscle mass, the strength, just building and maintaining that, maintaining energy levels, definitely helps with mood. We usually see like depression setting in when the testosterone drops. Helps to prevent vaginal dryness as well as the other two. Protection against heart disease, a big one that's actually been studied a lot lately with all these different hormones. Decreases inflammation overall and helps with the urinary symptoms as well too. So you could see definitely a trend with all of these hormones and their functions and how they intricately work with each other to help to support a healthy female body and function. So when we start getting depleted, why not replace them safely? Okay, so we're going to talk about that too. But let's look at these two. So here on this slide is just reminding us where these hormones are produced. So these, the first three are primarily produced in the ovaries. There's a small amount that's produced in the adrenal glands as well too, but primarily in the ovaries in the female. Now, I know that some of you have seen when we're checking hormones, I just wanted to explain the FSH and LH. So there's a follicle stimulating hormone and a luteinizing hormone, and they're referred to as feedback hormones. So the FSH basically stimulates the growth of ovarian follicles and production of estrogen from the ovaries. And the LH triggers ovulation and helps to stimulate the production of progesterone and testosterone. Mm-hmm. So we use these as feedback hormones to determine how much is your body producing based on how much it's triggering these hormones to be produced. So basically, it's almost like the thyroid. When we talked about thyroid,
yes,
we talked about the TSH being feedback. So the lower the amount of the actual progesterone, estrogen, and testosterone you have, the higher that feedback hormone would be. So again, if we go back to a healthy menstruating female that's not having any hormonal symptoms, you would see that they have a relatively low LH and FSH because their body is producing a healthy level of all three of those, main hormones. Mm-hmm. And so basically, we want to make sure that, when we're looking at if you're in perimenopause, menopause, or even when we are replacing your hormones, that we're not just checking the actual hormone levels, but we're checking the feedback hormones as well, too, to make sure that we have that appropriate level and appropriate replacement going on.
All right, so when we're looking at imbalances, all right, so when someone is not in the right hormone, when they don't have the right hormone levels within their body, so many things can happen. So I think one of the most common ones is in like menstrual irregularities. This is when obviously periods are not regular, you're not having a monthly cycle, you can't have heavy bleeding or even less bleeding, or missed periods. That's a big one. Infertility is a huge one as well, because like we mentioned before, progesterone helps with keeping the fetus in the uterus.
Yes.
Estrogen helps with, getting the secondary sexual characteristics of the body developed. So they all have a very strong interplay. Now, going through menopause, once things begin to drop in terms of the hormone levels, you can see the hot flashes. Everyone knows about hot flashes, right? The night sweats, the mood swings, the vagina, all these are those secondary side effects of having that hormone levels drop in the body. Osteoporosis, that's a bad one. That's when the bones are weak. That's when you're more prone to fractures. And this happens as we age, especially for women who have the loss of the hormone drive. Heart disease, we talked about that before.
Oh, yes.
Progesterone and estrogen and testosterone, but mainly progesterone and estrogen help with protection of the cardiovascular system by reducing inflammation, reducing LDL, increasing HDL, and reducing the formation of what we call foam cells. A foam cell is basically a macrophage, which is a white blood cell that's kind of like let's call it a policeman in the body. A policeman actually. And what they do is, if there's a surplus amount of cholesterol in the body, it eats it up. And when that happens, it turns them into a foam cell. And foam cells aren't good. They're sticky. And they increase inflammation and they increase the risk of plaque being laid down in those arteries. So it's important to have that. Another reason why we have heart disease issues is when you lose the hormone drive with regards to progesterone and estrogen, you end up losing nitric oxide synthetase activity in the actual blood vessels. And what that does is helps with contractility and elasticity of your arteries. So you lose that drive, you lose the production of nitric oxide. Nitric oxide then is not there to allow for the blood vessels to kind of dilate and contract easily. Guess what happens? You have inflammation, plaque buildup. And you also have, most people don't realize, there's an increased incidence of hypertension in postmenopausal women, and it is linked to this same phenomenon, the lack of the drive, which reduces the elasticity in the arteries. So, there's many reasons why we need to be looking more at women in the postmenopausal age and having a discussion with them, because I'm sure that those of you out there, women out there who are wondering, why did I get hypertension in my 60s? I never had blood pressure issues. Why do I have coronary plaque in my arteries? I've been exercising my entire life. They have all these questions, and the standard answer you hear from your healthcare practitioner is, well, you're getting older. worst thing to say to someone. So, and with regards to mood disorders, that's another big one with hormonal imbalances. Depression, anxiety. A lot of times what you can find is other hormones as well begin to go out of whack, and like cortisol and even melatonin and all those
thyroid,
some thyroid dysfunction as well when people go through menopause. All these hormones interplay and cohabitate with each other in the body.
Absolutely. Now that you know all of this, how do you what lifestyle changes are you going to make to help to maintain healthy hormone levels, or when that time comes, at least help to balance the hormones?
Yes.
So, we have talked a lot about so much of this with respect to, like these lifestyle changes with respect to other things on our podcast. So you might see a common theme here where we're talking about sleep and stress and weight and diet. But, it is really important to stress that all of this is important to help to reduce your inflammation and help to just maintain a healthy body, healthy function.
Yes.
And, even with respect to hormones, all of these things are important. So, making sure you get 7 to 8 hours of sleep. Make sure you're eating a diet that's rich in antioxidants, rich in fiber, just avoid those sugary over processed foods. Healthy lifestyle in terms of exercise, regular exercise. We talked about exercise so many times, but whether it is something daily that you need to do to move your body. I tell people, just move your body, whether it be walking, going going to the gym. Definitely weightlifting is really important with hormonal. When we're talking about hormonal health, Dr. G talked about testosterone and being responsible to help with muscle mass and muscle strength. So doing that regular, whether it be body weight or using, going to the gym, using the machines, doing the dumbbells, some kind of weight exercise. And weight-bearing exercise actually helps with bone density.
It sure does.
So as you're approaching that age where your hormones start doing, crazy things, it definitely helps with bone density, helps you to prevent from going into your osteopenia and osteoporosis early or at all. Actually, the aim is not to get to osteoporosis. So all these lifestyle changes, so important. Though this one is a whole other topic on its own.
It sure is.
Limit exposure to toxins. So I'm sure that you guys have seen so much on different toxins around
Oh my
us.
gosh, yes.
There's, day by day, I see new articles, new studies, etc. I mean, there's been the whole industry of the pesticides, and spraying our foods with pesticides and us ingesting that stuff. That's a completely different thing. So the one is the food industry and all the things that are being put in foods. We talked about the genetically modified foods as well too, and how that can impact our body negatively.
Foods too.
Hormones and antibiotics that they use in the meats and comes in the milk, etc. And then you mentioned plastics. So what were you going to say about plastics?
So I mean, we know plastics are endocrine disruptors, and they're everywhere. So it's I would say it's a tough thing to kind of remove completely from the environment, because guess what? We've made so much of it.
Absolutely.
But reducing your exposure, and that's the thing with all these chemicals, all these things, you cannot put yourself in a bubble made of glass to avoid any of them. But here's the thing, that's impossible.
Yeah.
So the one thing you can do is just reduce your exposure to these on a daily basis. Be mindful of what you surround yourself with. I mean, there's even endocrine disruptors, which are chemicals that affect your hormonal imbalance in the body, not just with the sex hormones, with all hormones. There's even dyes. There's even chemicals that we use in cosmetics.
That's a big one, actually.
Where you got to really be careful of. You
talk about parabens and phthalates. These are all endocrine disruptors, which basically When your body's exposed to a certain level of them, it influences negatively your hormones, not just hormones, but other things as well too, but mainly the hormones. That's why they call endocrine disruptors. And yeah, a lot of household products, down to like what we like soap, and what we use on our clothing and to wash them,
clothes,
the softener, like there's so many things. And again, like you said, we can't avoid them completely, so limit the amount of exposure, like limit for the plastics, limit how much, those
plastic water bottles.
Water bottles.
Go steel. Get some steel bottles. Those are good, actually.
Steel bottles,
or even glass,
And I know a lot of plastic wear right now says BPA free. And yes, like if you make sure that the liquid stays at a certain temperature.
That's the thing.
Yeah, you're probably okay with it. But like if you stick it in a microwave, for
game
example, like it's gonna start releasing certain chemicals that doesn't, then it's not BPA free anymore. So just certain things that you need to know. Again, we can go on all day about this. But there's so much out there on the internet to read about this stuff, things that you should avoid. But yeah, these toxins are all around us. You get exposed every time you walk. I mean, they're in your house, but every time you walk out of your house too, you have, so just limiting. And, when you eat healthy and you exercise and you get good sleep, your body is more prepared to deal with these toxins in terms of getting rid of them efficiently. Because our bodies they're pretty smart. Your body's pretty smart and helps to break down certain things and get rid of. But you've got to treat your body well. For it to function well. So again, goes back to your lifestyle changes, goes back to your healthy habits. And that's why we keep,
active.
That's why we keep talking about this stuff. So hopefully, eventually, it would definitely stick with you.
Now, before we switch off, you mentioned muscle. Now, one of my mentors in medicine, someone I follow deeply at a conference, he made the comment which stuck with me, and I've been using it with my patients since. Muscle is the currency of aging. So if your bank account with regards to muscle is low as you age, you're going to end up in poverty, health-wise, which is not a place to be. So it's important to remember that. And for my ladies out there who, when I discuss with them, hey, maybe let's go to the gym, lift some weights. Everyone gives me the pushback. Oh, I don't want to look like a bodybuilder. So rest assured, unless you're someone who works out 3 to 4 hours a day, heavy lifting, 5 to 6 days a week, and it's your job, and you're, let's just say, eating 3,000 to 4,000 calories a day, that's never going to happen. We're going to the gym on a 3 to 4 times a week basis for half an hour to lift a little bit of weight. It's not going to happen. So I do recommend that. I mean, we have ladies in our practice right now who are building muscle because we do a lot of biometric testing, and we definitely do test their body compositions. And it's amazing to see them go from one level to another over the course of a few months by making these small changes.
And they don't look bulky. Like
they don't. They feel stronger.
They look like trim and fit because that's what muscle does. And the female body is built differently from the male body. So that's why muscle gain for us looks differently, unless you're really training for bodybuilding competition and you're doing all the things that Dr. G said and, drinking 5 grams per kilograms of protein a day or something like that. And you can't do that for very long, by the way. Usually people would do that for a competition or something, a show or something. But no, if you lead a regular diet, and regular lifestyle, and you go and do your 3 to 4 times a week, like you said, 20 to 30 minutes a day of lifting, it's just going to nicely build some muscle, trim you out, stronger, make you feel stronger. That's what we want. Like, as we age, we don't want to feel like we're getting more unstable, more prone to falling. That's what happens actually to most people. You want to maintain that muscle mass so you feel like you can still do the things that you could do 10 years ago and not be fearful of, an injury or something like that. All right. So, of course, we always talk about supplements that can help, right? Yeah. I mean, if you can achieve certain things with taking a supplement before we get to prescription meds, let's do so. So here are a few up here. The first one is Vitex. Sometimes it comes in that name, but it's actually from the chaste tree berry. It's an extract. And this herb actually helps to regulate menstrual cycles and reduce those PMS symptoms that women typically get like in that last 2 weeks of their menses. Magnesium, another one that you probably have seen on almost every one of our episodes because it has so many different benefits. It actually helps to alleviate PMS symptoms and it helps to sleep, which is really important for hormonal health. Omega-3 fatty acids, again, one of the common ones you might hear with us because it helps to reduce inflammation and it helps with conditions like polycystic ovarian syndrome. Vitamin D, again, one that everyone should be taking. It should be in the water. It helps to balance hormones and help with immune functions. Probiotics, these are good bacteria that definitely can help to balance hormones, help with healthy gut. Healthy gut is important for hormonal balance. Yes. Because again, like we had said in our GI series, most things that affect the body enters
through
our mouth, through the gut. So it's important to know what you're putting in your body.
Now, I know one wasn't on the slide, but I know you know about it, so
I think there's another slide too.
But wait, there's more. Let's see it.
There's one more on there, and if it's still not on here, Dr. G,
I see it's not, and I'm going to try and stump you.
Okay, you going to do that right now?
No. Keep going. I got you.
All right. Well, let's move on then with our next one, which is a maca. It's a root from Peru, and it helps to boost energy and libido, actually. Black cohosh is one that's used by a lot of peri- and postmenopausal women to help with hot flashes and night sweats. Dang quai is a well-known Chinese herb, helps to regulate the menstrual cycle and menopausal symptoms. So you could use this if you're still menstruating or after menopause. Evening primrose oil has GLA, which is the fatty acid that helps to reduce inflammation and helps with PMS symptoms. And licorice root, we talked about this as being an adaptogen before, help to manage stress and helps to balance hormones. There's of course, I just gave you a long list of stuff there. You're not going to use all of them together, but, depending on what what symptoms you're having, what's affecting you at the time, you may try one or two to start with, and definitely talk with your doctor, your healthcare provider to see what would be best for you. Because as we had said before about supplements, they're not all benign in terms of side effects. Like they can definitely interact with other things, other medications. So you want to make sure that what you're taking is definitely safe.
So,
yes.
Now tell me, I've been reading about a supplement, or should I call it a herb?
Okay.
What do you know, or what are your thoughts about the use of Siberian rhubarb in treating women's hormone health?
So rhubarb extract,
yes.
It's kind of one of the maybe newer kids on the block. And of course, there wasn't everything on the slide, but yes, this is a newer one. There is a new product that just got launched. There's certain supplement companies that we like to use based on their quality, etc. And one of them is orthomolecular that we do have in our practice.
We use them at home.
And we use them ourselves, absolutely. And so there's a new product from them that's called Rubestrin. It literally got launched like 2 weeks ago.
I think so.
Literally.
Within the last month?
Yes.
Maybe?
Yeah, within the last month. Because I know we just brought it in last week. We just got our order in last week. And so it is it's been proven to be a selective estrogen receptor agonist. So you have different receptors for estrogen. These receptors are found all over the body, including the bones, the heart, definitely in the GYN system, so the breast, the endometrial tissues. And there are different, there are some receptors that are thought to be more proliferative. When we use that word proliferative with respect to hormones, it means that it helps to, it stimulates that tissue more in a way that it could almost be negative if it's too much. So, you don't want too much proliferative action on the breast tissue and endometrial tissue. Again, going into, like causing problems down the line with cancer and other hormonal conditions. So the rhubarb extract actually acts on the beta receptor for estrogen, and that's been shown to help significantly with the symptoms. So it's really there to help to regulate those receptors and the symptoms, primarily hot flashes, mood. It's been shown to help with mood, particularly. The fatigue that comes with it also helps with sleep, libido as well, the vaginal symptoms. So a whole range of symptoms that can come about because of not just the lack of estrogen, but the fluctuations, especially during perimenopause, when one day your hormones could be on the floor and the next day they're up there. Like that big fluctuation in hormones definitely produce a lot of symptoms. And so this rhubarb extract with stimulating those beta receptors have helped to balance those symptoms. At least that's what is shown in the studies so far. As I mentioned, we will talk more about this topic in more in our podcast series to come, and we'll talk more about these, like the newer things that are coming out, because that's what we want to do, is keep you up to date on the newer modalities, the newest supplements, new therapies, so that you're well informed as well too on your end.
Okay, fine. I guess you know a little bit about you're in rhubarb. Jeez.
So, that was quite a bit that we just gave you, right?
Yes, it was.
And I know we still haven't really touched menopause or perimenopause, so we're gonna hit you up with that in the next one to come. So make sure you tune in for the next episode. Anything else to add, Dr.
No,
G?
I think this was good. This is a good foundational start to hormone health for women. I think for those women out there who may be dealing with these symptoms and not knowing what's going on in my body, it's a good way to at least make some notes. Jot some notes down, what you think you're going through, and get in contact with your qualified healthcare provider or doctor and say, hey, I think I'm dealing with some of these things. I need help, or find a doctor who understands all the intricacies of hormone imbalance and make the introduction and go in and get help, So this is what we want you to do to live life better with us here at AMG. And thank you for tuning in to the Vitality Vault. Today was awesome, and tomorrow is going to even be better with our next one.
It was a pleasure having you. We'll see you again soon.
Bye, guys.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.